Thank you. My name is Edward Abrahams. I'm the president of the Personalized Medicine Coalition. Being in London, I'm mindful that 10 years ago, the Royal Society published a paper said that personalized medicine was not likely to happen in their lifetimes. And now, I'm not hearing that at all, that it's actually here, and according to many people who've spoken already, it's here, but we can't afford it. And my question is, despite the eye-popping price tags that we're seeing on some oncology drugs, is there any effort in Europe to study the systematic cost of increasing value, efficacy, safety, et cetera, to the health system writ large, so that we can get a better handle on what Sir Richard introduced the conference as a fear that I think pervades much of the discussion?
Why don't we start? I'd be interested in everyone's view on this. Paolo, how does pricing and value fit into this debate?
Well, it is absolutely true that there is a process ongoing. It's not easy, because until now what is lacking is the fact that we are able to manage the cost and so the value in a more comprehensive way. We are still working in a silos model inside the different NHS, even if there is the possibility to evaluate the right value of a new therapy, especially in the field of personalized medicine. We are not yet able to use the resources in a more comprehensive way, and to be able to be flexible also in the system as a whole. This is the real problem, and this is the real challenge also of the actual HTA approach, because we are able to identify possible saving or possible benefit that will come from a new personalized medicine. But if we are not able to be flexible as a system and not divide the different department or segment in silos, then it will be much more challenging to find out the way to really be open to the introduction of that kind, especially to that kind of medicine like the personalized one.
Hans-georg, are we moving towards a world where the assessment of safety and efficacy is going to be in tandem with assessment of price and value? Is the EMA comfortable with that? Do you have a role in that? Address these points on price.
Well, as Paolo has said, there are so many similarities when it comes to value. Let me park price. We have nothing to do with price. But what is value? And it harks back to this gentleman's question. What is value? It is ultimately something that is done to a patient living in a society. So you can speak of societal value or patient value. Is there such a difference between benefit risk? I don't see much of it. You may have slightly different questions asked. And the big question is always, do you look at absolute benefit risk or is it comparative? The future that I see is that under an adaptive pathway, we will address the value question very much in parallel, if not identical, to elucidating the benefits and the risks in a healthcare system. I see very few differences here. And what we are going to learn, hopefully, addresses your question, sir, the value. Because today, what you do is you get a new drug that is being studied in one or two, often comparative trials. And the comparator, let's say, standard of care, as is in many serious diseases. And that gives you a certain effect size. That effect size, to a degree, drives your value. If it's high, the effect size, you know it's more than if it's low. Now, ultimately, that product, if it goes to market, will be utilized in combination with other treatments. It will be utilized instead of first line, second line, or vice versa. So that value will evolve over time. And it may be that it increases or decreases. And the only way to find that out is in the downstream part of the lifespan of the product. That is why we need to extend that whole assessment period throughout the lifespan in order to come to that value.
I mean, Stephen, I mean, clearly EMA isn't going to have a role in pricing, but it's clear, is it not, that we are moving towards a world where performance data from the adaptive licensing process is going to play an increasing part in setting that price.
I absolutely agree, Andrew, and I think there is an inevitability to this. And I think if you look at real-world evidence and changing data and exposure to bigger populations that feed back into a value mechanism, I think there is an inevitability that the regulator takes some role in this in terms of value assessment, but not in terms of price assessment. That would be the big issue and the big challenge. Very difficult to evaluate that at a European level. But I think there is an inevitability about that. And in some respects, that's probably good for efficiency, because you will have 27, 28 different agencies assessing value in the European Union, and some of that is duplication. So I think it would actually, probably from a policy perspective, would be quite widely welcomed.